minimally invasive retrocalcaneal spur removal. This works real good in most patients, and the recoveries are much quicker than our traditional way of detaching the tendon and reattaching the tendon. This is an example of this patient, and we'll show you his x-rays because it looks different than traditional procedures. So basically, a patient with a heel spur in the back of the heel, what they're going to have an underlying Haglund's deformity, which we address by making an incision here, and on the outside these are percutaneous incisions, and we reduce the basic Haglund's portion. So if you were to look at the back of someone's heel that had a Haglund's deformity, basically it's a little lump up here that interferes with the tendon moving properly. He also has a spur on the outside portion. So the way this works is the tendon is being pinched by this little bump here, which we call the Haglund's deformity, and then shoe pressure hurts the heel back here because there's a little spur here. So what we do, we first take off this area here, which we do through here, and then we make another small incision, which you really can't see on his foot now, and we go on the outside of the tendon. We don't detach the tendon, and the spur that's on the outside, we reduce that, or we detach the spur from the plantar aspect of the Achilles. And then what that will do, the spur will still be intertendinous, but it won't be attached to the bone, so basically it doesn't hurt. So we're removing the Haglund's deformity and freeing the spur from its attachments, and trying to get most of that out, to get as much of that out as we can. But basically, most patients are pain free with the procedure. So it allows us to do this without detaching the tendon, without excessive post-op recovery, which the traditional surgery does have. Now, how long are we out now with our surgery?
This is my 5th week.
So this is week 5, and he's already been able to walk without a shoe. When did you quit wearing a boot?
First of last week.
First of last week. So you wore a boot about 4.5 weeks, and you know, not having that huge recovery you have with open heel spur, you know, retrocalcaneal heel spur. With very similar results. As a matter of fact, the VAS scores in the earlier aspect of this surgery are vastly better so far. So basically, now with your foot, before the surgery, what, six weeks ago? Was it six weeks? Roughly 6 weeks ago. Your foot 6 weeks ago. What was your pain scale from 0 to 10 on a daily basis?
8 to 10.
8 to 10. So now that you've had this done, you've been walking with your regular shoe, or at least a surgical shoe. What is your pain in your foot now?
I had no pain.
Zero pain. So we've got zero pain in this surgery, without him being on an extensive post-op journey, you know, trying to get his foot better. Now, that doesn't mean that the open surgery doesn't work. It does work. The open surgery works. It's one of the best working procedures that we have. It's just that the recovery is so long. Some people, when we do open surgery, it takes them 6 months to get over. With this particular surgery, they're good to go in about, you know, 8 weeks or so, back to even work. Are you back at work now?
I'm back at work.
So he's already back at work. So obviously, if we'd have done this open, you know, he wouldn't be back at work. Matter of fact, he told me today, so when we're going to do my right foot, and we'll get that done as soon as we can too. So basically, this is a great procedure. You don't burn any bridges. If you have to go back in open, you could still do that. So worth a try in some of the patients. Obviously, a really, really big posterior heel spur, you might still have to open. So these are going to be your calcifications that are thinner in the posterior area, or milder. So there's no real way to say when it works, when it doesn't. But so far, I've been doing this on kind of people that have the Haglund's, which are always present in a posterior heel spur, and who have a retrocalcaneal spur that is thinner, or we were able to detach it from its insertional area.